pressure. Well, each year, more and more young Bahamian women in their late 20s, early 30s are being diagnosed with breast cancer. For some of these breast cancer warriors, the disease is hereditary, while for others, it's the first for their family. October is Breast Cancer Awareness Month, and joining us live in studio to educate Bahamians about the uptick in numbers among young Bahamian women and women in general is consultant surgical oncologist Dr. Wesley Francis. Dr. Francis, welcome to the Bahamas Tonight Access Now.
Well, thank you, Ms. Davis. Thank you for having me. Happy to be here.
So, Dr. Francis, talk us a little bit about what is breast cancer and its symptoms.
Well, I think the right question is, what is cancer? And cancer is really cells that have lost their ability to die. And so they continue to grow and exponentially at times. And so if you have those cells within the breast, then that's called breast cancer. For women, in terms of symptoms, it's really a lump or growth in the breast, or, for example, or under the arm, or changes in the skin, changes in the nipple. Also, if, especially in an older woman, a discharge that is have a bloody quality, those are some of the symptoms of breast cancer. But we prefer to see breast cancer really if it's screened. Screen-detected breast cancer is usually where there's some calcifications that are noticed on the mammogram, and then if it's suspicious, then you get a diagnosis that way. Early screen-detected breast cancer usually does very well because you catch it early, it hasn't spread yet, rather than when someone has symptoms. When you have symptoms, it's usually a later stage, and the prognosis is not as good as if you have screen detected. That's why the emphasis is really on screening.
So tell us, so far this year, how many new cases have you seen on new diagnosis in older and or younger women?
So it'll be difficult to say, but what I could tell you is what is we based or data that we have from our registry. So the Bahamas National Cancer Registry started in 2018. And before then, the way we say how much cancer is within the country is incidence. It's called incidence, and it's number per 100,000 females. And so when the registry first started in 2018, it was about like 106 per 100,000 females. That was really high. And then, but what we noticed is there's been a gradual decrease in trend. But I believe that it's falsely decreased because during the COVID years, we didn't really, a lot of people didn't screen. And so the numbers kind of went down from the registry. The registry data all over the world are usually about 2 years behind. And so the last number that we had is 69.3 per 100,000 females. Which, I mean, if you look at the numbers, it's probably around 200,000 females. So somewhere around maybe 150 patients would have been diagnosed, and that's in 2022. We have yet to see 2023's data, and we're in 2024. That wouldn't be seen until another year or so. But those are the numbers in the registry.
So what are some of your final thoughts as we continue to raise awareness this October for breast cancer screenings?
I think we just need to screen, and we need to be deliberate and intentional about screening women. The screening age is 40 and over, and the screening tool is using a mammogram. And breast cancer can't be prevented. It's about early detection. When you do detect this early, patients survive because they can be treated. And the treatments are usually successful.
Francis, thank you so much for joining us here on the Bahamas Tonight Access Now, and all the best to you and your team as you continue to educate women on breast cancer. Thank you so much.
Follow us at ZNS Digital on Facebook, Instagram, TikTok, or X. Subscribe to our YouTube channel and visit us on our website at znsbahamas.com.